Welcome to my podcast. Today I'm going to talk about another common case which is also important. So basically you have to introduce yourself to the patient and double check the patient name, date of birth as well as agreed. You'll ask the patient, how can I help you today? So it's usually someone who is in teenage or young people who might come with this kind of problem. So the patient might say, I'm having itchiness down below in the private area, or I'm having discharge, or I'm concerned that I might caught an infection because the patient might have multiple partner or casual partner, not regular one or steady one, or maybe they were abroad, they come across someone, they had drink, they lost their conscious, they lost control, and obviously the inevitable happened. So, sexual transmitted infection, it's a very important issue, and it's preventive. The preventive is the key factor in here, and it's not only a public health matter. However, it's a future health concern for any patient come across this thing because it might cause long-term implication. So, sexual transmitted infection usually is asymptomatic with long-term health implication for both the patient and the partners. And you need to take a detailed sexual history and give advice about safe sex practice. So this is the main point, or two main points that you need to tell your patient about if you come across as one of the stations in Lab 2 examination. So what would include, so basically you will ask the patient tell you about the story, and then you will ask about just quickly past medical history, family history, lifestyle, what do they do for life, and then you will hit the sexual history, especially if the patient says that I'm sexually active. And you need to ask how many sexual partners did you have for the last 3 to 6 months, and what sort of gender were they. So that's the main question you need to ask. So you need to know that anatomical sites of exposure is very important. So you need to always to emphasize about the safe sex practice, which imply use a condom, single use for each time or each act of coitus, whether it's in the vagina and the anus or orally. And you need to ask the number of the partner and their gender, as I say, in the last 3 to 6 months in order to cover the incubation period of that infection, because they might be asymptomatic at that period of time, but later on they might develop symptom or certain complication. So you will ask if there is any symptom that they have noticed. So the patient might say, I just came because I'm concerned because of this behavior I have. So I might caught an infection. I don't know who I slept with. I didn't know who I come across. Something happened. Just we were in a party, we drank, and then we just, things happen. So the patient might say something like this. So you need to also to assess this patient for blood-borne virus risk assessment for the patient himself and the partner. So you will ask if there is any involvement of, for instance, drug injection. What sort of injection was it? Do they know what they have taken? They say usually in those kind of party, they might be drugged, stuff like that. And you will ask, what practice was it? For the intercourse or the sex, which country was it? And if that country had the casual sex, for instance, if it's high prevalence of blood-borne virus infection, like for instance, certain country, whereby people travel sometimes for this kind of act and might cause infection which is predominant in that place. So you will ask also if she had sex basically with a man who had a history of sex with another man before, or maybe it's currently, so the man may be bisexual and could be between men and women. And if it was paid to receive sex, or if the partner has been contacted and been told. So always counsel your patient in a non-judgmental attitude with compassion and be respectful for them in order to encourage behavioral change and establish an effective rapport in order to move things forward and come to a management plan which the patient will be happy to take on board and utilize it. So you will ask always an open question with an understandable language. You need to double check the patient understood what it's being conveyed, and always advise about specific action, which, as I mentioned already, about the safe use of condom, whether with a new or a casual partner, and have a regular checkup for the sexual transmitted infection from time to time. Also offer those kind of patients a sexual health screen to those who are actively sexually active, with a recent change of a partner, which would involve nucleic acid amplification test for basically both chlamydia and gonorrhea, because they are the most common ones, apart from the others. And ask the patient, they can do the self-taken lower vaginal swab, throat swab if they were given oral sex, and a rectal swab if they have received anal sex. And also a blood sample for the HIV and the syphilis. And you can tell the patient the blood will include HIV as well. And always ask for a symptom. Usually, as I say, commonly it's asymptomatic. However, you will ask if there is any discharge, for instance, if there is pain with the wee, dysuria, or with the coitus, dyspareunia, if there is any ulcer in that area, or if there is any intermenstrual bleeding or postcoital bleeding. So don't offer the antibiotic until you know what you are treating basically, and also to avoid developing antibiotic resistance, because this is something emerging and it can be a public health issue as well. So if it's, for instance, if it was chlamydia, it was positive, so the first choice of treatment is doxycycline, 100 milligram twice a day for 7 days. However, if the patient is pregnant, of course, you wouldn't give doxycycline, you will give azithromycin. So the second choice is azithromycin, 500 milligram once per day for 2 days. And of course, you will emphasize about abstinence from sex during the treatment period of time. Look for any previous partner for the last, as I say, 6 months, because this is considered as a latency period where the partner might start to develop symptoms or complication. And always emphasize, as I said already, about a new condom should be used in each act, whether it was vaginal, anal, or oral. Now I'm going to talk about the patient notification system, which has been used in the UK. So it's basically done by the patient at the request of the health or sexual health clinic for partner referral to be treated and screened. So this is very mandatory. You need to request this from the patient. It's not something that you need to do yourself. You'll ask the patient, try to explain about the situation and how it might affect this partner, because the most important element in this situation is the prevention and control of STI, sexual transmitted infection. Because if it's not treated, and it's not only a public health issue, as I mentioned, a relapse can happen, and it can be an issue both for the patient and the partner. So in that regard, this is the patient notification system, which is very important that you need to mention in the Lab 2 station if you come across such a condition, in order to get a good mark. And by that, I hope that I covered the main points about sexually transmitted infection and how you need to deal with it in Lab 2 station situation. And you can share with your colleague and raise any question if you feel that there's something is not clear or maybe something I need to add. You must welcome to feedback to my podcast, which I always provide, and it's free for everyone. Thank you.